Good morning. You're watching Day 2 coverage of the World Healthcare Congress here in Washington, D.C. In our studio this morning, we have Dr. Nicholas Marko, Chief Data Officer at Geisinger Health System. Good morning, Dr. Marko. How are you?
Very good, thanks. Yourself?
Very well. And so you really pride yourself on the work in data that you do at Geisinger. Tell me a little bit about the program that you have there.
Yeah, so Geisinger is an integrated provider-payer network in central Pennsylvania. We cover about 3.5 million patients or so in the middle of the state, the part that's not Pittsburgh or Philadelphia, Harrisburg area, essentially. Data has been a part of Geisinger's culture for a long time. We adopted an electronic medical record system-wide in the mid-90s, so we've got more than 20 years worth of EMR data. But then, in addition to that, we've been scaling all of the other data that gets generated as a product of healthcare. So all of our operational data, financial data, the administrative data as part of the health plan and that sort of thing. So that's all been part of our data network for quite some time. More recently, we've decided that in addition to the traditional relational databasing that we did for a lot of these things, we should scale our data operations to include a large-scale big data platform as well. And the real impetus behind that was thinking about how effectively we can deliver solutions to the providers, to the end users, that sort of thing. As you know, a lot of the data that's getting generated in healthcare now, but also a lot of the data that we've just never had a chance to access has been data that's been in semi-structured or unstructured formats, and that's always provided a real challenge in a relational databasing environment. So we still have our relational environment, and we augment that with our big data environment, and we're aggressively moving essentially all of the data from our systems into that environment as well. So our entire EMR is connected, our administrative and claims data are on there. Really, it's a place to land multiple sources of data in their native format. And then some of the new technologies in that space allow us to layer a lot of applications on top of that that can be developed much more quickly and more easily than in a highly normalized, relational structure. And so we've been able to build, interactive data visualization environments facing the end user very quickly by leveraging this platform. And it's really all about getting solutions out to the end users that allow our physicians to see the data, to touch and feel and interact with it, to get rid of intermediate layers so that you can just sit down with your data and have an idea or speculate about something that might be a direction that you can go to improve patient care, and you can see your data in front of you and move it around and interact with it live. So we've really been focusing on trying to get solutions directly out to the end users as well without a big complex intermediate layer. And so I think these things, the integration of big data, the bringing in of multiple data sources that we couldn't really work with well before, and the idea of federating things out as much as possible to the end user so that there's fewer barriers between people and their data are really the things that have been big for us lately.
Well, now what are the results of that work? If you talk with a physician, the end user, as you're referring to him as, what are they reporting to you that this is helping them do better?
Sure, absolutely. Well, we're still fairly early in this process. We started building our big data stack in October of last year in earnest. I mean, we had done R&D things around, making sure that it would work in our system. So a lot of the work we've been doing the last several months is getting data loaded in. But just in the last month or two, we've really started developing these kind of solutions to push out to the end users. And so far, the response has been very positive. So one good example is, we have an ACO, and there had been a lot of challenges in the past integrating all the pieces of data that come into that ACO, and so people were working in a variety of different environments. Just this week, we're rolling out a new environment for the ACO that really brings everything together and puts a lot of the key metrics that they care about in a place where they can touch and feel and interact with it. There are provider-centric views, there are case manager-centric views, there are payer-centric views, all essentially built off of the same section of the data set, and the initial response to something like that has been very favorable. People are telling us that they're able to do things with their data that they haven't been able to do, that the workflows are much quicker and much more integrated. So we're really happy with our initial successes, and we're very much in an aggressive ramp-up mode right now, trying to get as many of these kind of things out to physicians and end users who've wanted them for some time, but were constrained by previous technologies, and everything we're hearing right now is very positive.
Now, if other integrated health systems wanted to implement what Geisinger has had a head start doing already, is that what they're going to need to really ramp up to Geisinger's level to have some success in this environment?
Well, I think that there are a number of healthcare organizations that are really thinking about how to leverage this big data space. And for us, it's not about the technology, it's about what the technology enables you to do. But I think one thing that any health system that's interested in really getting the most leverage out of their data and getting the most kinds of data available to the most people need to think about is, number one, developing an enterprise strategy around that. So one of the first things that we did as we started to make this transition was to put together an effective and broadly distributed enterprise data strategy group that looked at all of the needs from all of the sections of the business and really said, okay, how do we leverage our data to get the maximum value out of it and to work on maximal fronts simultaneously. So one topic that I talk about a lot is the importance of a data strategy and how to build that, because otherwise you're just building a bunch of random use cases and sort of moving forward in the dark. The technology part of it, I think, is important, and you've got to have somebody who knows what they're doing with that and have a real synchronization between your strategic objectives and your technological objectives and capabilities. It's not so important in my mind exactly which type of data stack you use or which hardware or software you employ, but I think a big conceptual thing is that people are really starting to move out of the EHR for innovation space, because EHR is an important part of what we do, but we've also got lots of other data, and you need a place where you can put all of those things together. We have for years done a lot inside the EHR and had good success with that, but it's a very laborious build process. It's a constrained environment, and we find that taking data out of the EHR and putting it into some sort of platform where you can really leverage all the tools that are floating around out there, from open source to highly developed software tools. A good sort of general platform can have all of these things layered on top of it, and the data can be structured in lots of different ways in that platform. And so I think being strategic and really making an effort to get outside of the EHR and put together a data system in and of itself are two really important parts to doing that.
Okay, Dr. Marko, thank you so much for your time today.
Oh, it's my
I really
pleasure.
Appreciate it.
Thanks for the invitation.
And I'm Mabel Jong. Thanks for watching. Stay tuned for more.